Understanding rabies, symptoms, prevention, and treatment explained. Hello and welcome to our video on understanding rabies. Rabies is a viral disease that affects the nervous system of mammals, including humans. It is transmitted through the saliva of infected animals, typically through bites or scratches. Rabies can be fatal, which is why it is important to know how to prevent and treat it. In this video, we will be discussing the origin of rabies, its symptoms, how to prevent it, and how to treat it. Origin of rabies. Rabies is a viral disease that affects the central nervous system of mammals, including humans. The virus that causes rabies belongs to the genus Lyssavirus, family Rhabdoviridae. The origin of rabies is not well understood, but it is believed to have existed for thousands of years and has been present in many parts of the world. One theory suggests that the rabies virus evolved from a virus that infected bats, which are known to be natural reservoirs of many viruses. It is possible that the virus was transmitted to other mammals, including humans, through contact with bat saliva or other bodily fluids. Other animals that can carry the virus include dogs, cats, skunks, raccoons, foxes, and coyotes. Another theory proposes that the virus was originally a virus that infected carnivores, such as wolves and jackals. The virus may have then spread to other animals, including domestic dogs, through contact with infected saliva. Regardless of the origin of the virus, rabies has been a known disease for thousands of years. Ancient civilizations, such as the Babylonians and Egyptians, recognized the symptoms of rabies and had some knowledge of how the disease was spread. In the 19th century, the French biologist Louis Pasteur developed the first successful vaccine for rabies. Pasteur's vaccine was based on the principle of immunization, in which the body is exposed to a weakened or dead form of the virus, allowing the immune system to build up resistance to the disease. Pasteur's vaccine was a major breakthrough in the prevention of rabies, and it paved the way for the development of other vaccines against viral diseases. Today, rabies is still a serious public health concern in many parts of the world, particularly in developing countries where access to healthcare and vaccines is limited. However, with modern vaccines and improved public health measures, the incidence of rabies has been significantly reduced in many parts of the world. Symptoms of rabies. Rabies has two stages, the prodromal stage and the acute neurological stage. During the prodromal stage, which can last from 2 to 10 days, the infected person may experience flu-like symptoms such as fever, headache, and fatigue. They may also experience pain, tingling, or itching at the site of the wound where the virus entered the body. During the acute neurological stage, which can last from 2 to 7 days, the infected person may experience a variety of symptoms that affect the nervous system. These symptoms can be severe and can include anxiety, agitation, confusion, hallucinations, and delirium. In some cases, the person may become hypersensitive to touch, light, and sound, and may experience muscle spasms or convulsions. Another classic symptom of rabies is hydrophobia, which is an extreme fear of water. People with hydrophobia may panic or become agitated when presented with water or other liquids. This is because the muscles used for swallowing become paralyzed, making it difficult to swallow liquids. Other symptoms of the acute neurological stage can include paralysis, coma, and eventually, death. Prevention of rabies. Preventing rabies involves both animal control and vaccination. It is important to avoid contact with wild animals, especially bats, and to keep pets vaccinated against rabies. If you are bitten or scratched by an animal, wash the wound thoroughly with soap and water and seek medical attention immediately. If you are traveling to a country where rabies is common, consider getting vaccinated before you go. Treatment of rabies. If you are infected with rabies, there is no cure. The only treatment is to receive a series of injections called post-exposure prophylaxis, PEP. PEP involves a dose of the rabies vaccine, which is given immediately after exposure, and then several more doses over the course of several weeks. If you have been bitten or scratched by an animal, it is important to seek medical attention immediately so that you can receive PEP. Rabies is a serious disease that can be fatal if left untreated. It is important to know how to prevent and treat it. Remember to avoid contact with wild animals, keep your pets vaccinated, and seek medical attention immediately if you are bitten or scratched by an animal. If you have any concerns or questions about rabies, please consult your healthcare provider. Thank you for watching this video on understanding rabies.